Welcome to aminacademy.com and psychology of mind and behavior. Let us discuss about health psychology. What is mental health? Mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and act as we cope with life. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important to at every stages of life from childhood and adolescence through adulthood and aging. What are mental disorders? Mental disorders are serious conditions that can affect your thinking, mood, and behavior. They may be occasional or long lasting. They can affect your ability to relate to others and functions each other. Mental disorders are common. Many Americans will be diagnosed with one at some time in their life. Worldwide is it's true. But there are treatments. People with mental disorders can get better and many of them recover completely. Why is mental health important? Mental health is important because it can help you to cope with the stresses of life, be physically healthy, have good relationships, make meaningful contributions to your community, work productively, realize your full potential. Your mental health is also important because it can affect your physical health. For example, mental disorders can raise your risk for physical health problems such as stroke, type 2 diabetes, and heart diseases. What can affect my mental health? There are many different factors that can affect your mental health, including biological factors such as genes or brain chemistry, experiences such as trauma and abuse, family history of mental health problems, your lifestyle such as diet, physical activity, and substances use. You can also affect your mental health by taking steps to improve it, such as doing meditation, using relaxation techniques, and practicing gratitude. Can my mental health change over time? Over time, of course, your mental health can change. For example, you may be dealing with a difficult situation, such as trying to manage a chronic life illness, taking care of an ill relative, or facing money problems. The situations may wear you out and else overwhelm your ability to cope with it. This can worsen your mental health. On the other hand, getting therapy may improve your mental health. What are the signs that I might have a mental health problem? When it comes to your emotions, it can be hard to know what is a normal and what is not. There are warning signs that you may have a mental health problems, including a change in your eating or sleeping habits, withdrawing from the people and activities you enjoy, having low or no energy, feeling thumb or like nothing matters, having unexplained anxious and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusual, confused, forgetful, angry, upset, worried, or scared, having severe mood swings that cause problems in your relationships, having thought and memories that you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, not being able to perform daily tasks like taking care of your kinds, kids, or getting to work or school. What should I do if I think I have mental health problems? If you think that you may have a mental health problems, get help. Talk therapy and or medicines can treat mental disorders. If you don't know where to start, contact your primary care provider. Now let us discuss further detail about psychology of mind and behavior, some health psychology. Psychology as a study of mind and behavior encompasses health psychology, which specifically examines how psychological, behavioral, and cultural factors influence health and illness. It explores how people stay healthy, why they get sick, and how they respond to illness. Health psychologists also work to promote well being and prevent illness through interventions. Some elaboration will do. Psychology of mind and behavior. Psychology is a broad field that investigates how people think, feel, and act. It explores the biological, social, and environmental factors that influence our mental processes or behaviors. This includes topics like perceptions, cognition, emotion, motivation, personality, and social interactions. Psychology seeks to understand both typical and atypical behaviors, and it aims to improve individuals and social well being. Health psychology. Health psychology is a specialized area within psychology that focuses on the psychological aspects of health and illness. It investigates the interplay between psychological behavior and cultural factors of health. Health psychologists study how these factors influence physical health, illness, and the healthcare system. Their work involves understanding health behaviors, promoting healthy lifestyle, and developing interventions to prevent illness and improve health outcomes. Some key areas of focus in health psychology: health behaviors, understanding and changing behaviors like diet, exercise, and smoking habits. Stress management, helping individuals cope with stresses and its impact on health. Chronic illness management, assisting individuals with chronic conditions like diabetes or heart diseases to manage their illness and improve their quality of life. Illness prevention, promoting a healthy lifestyles and behaviors to prevent illness. Healthcare system, improving the patient experience and promoting effective healthcare practices. In essence and summary, we can get it. Health psychology bridges the gap between psychology and healthcare, focusing on the psychological aspects of health and illness to improve overall well being. So far, we discussed about psychology of mind and behavior, and that we discussed about health psychology. We have done. Please subscribe our YouTube channel.